In May, President Museveni signed the Uganda Human Organ Donation and Transplants Bill 2023 into law. The law aims at providing regulation in the removal, storage, transplantation of human organs, tissues and cells for therapeutic purposes, to prohibit commercial dealings in human organs, tissues and cells, among others. According to Dr. Frank Asimwe, a transplant surgeon, Uganda will soon start the living donor program.
There are about 3 groups of relations that we consider in transplant. They are what we call first-degree relatives or first-degree donors. These are your biological children, okay? These are your siblings, and these are your parents. Again, we are in the season of DNA. Is he mine? Is she mine? Is he mine? Not mine. Those notwithstanding, there must be that degree of relation.
After about 5 years, the country will then proceed with cadaveric programs, which involves organs, tissues or cells retrieved from brain-dead individuals. The law clarifies that brain death will only be confirmed in those with irreversible damage to vital brain centers.
It means this person has got an accident or he's sick, usually accidents. His brain has switched off. He cannot breathe on their own. They cannot blink. They are basically on life support. They are being intubated, they are in the intensive care unit, and they are being ventilated, either manually, but usually with machines. So, but there must also be confirmation that this brain death is irreversible.
The Act further states that organ tissues or cells shall not be removed from a brain-dead donor unless valid written consent has been obtained. That consent must be obtained after a person has been certified as brain-dead in accordance with the nationally certified criteria approved by the Council, among others.
So you then will that if I get brain-dead and my organs can save a life, please take them.
Medical experts have stated that they are in the process of preparing and equipping themselves for organ transplant procedures.
Ugandan surgeons are not yet ready, but Uganda is ready. Our mantra in the transplant program is that we want to have organ transplant on Ugandans. You can say that's already happening. In Uganda, that's what we want to achieve, by Ugandans.
Despite public discussions about selling organs for monetary gain, the Uganda Human Organ Donation and Transplant Act strictly prohibits any form of compensation to organ donors. Organ donors are not entitled to financial rewards or any other kind of compensation except for justifiable expenses approved by the Council. Furthermore, the sale of any organ such as kidneys by a living donor for financial gain is prohibited. Hospitals interested in conducting organ transplants will undergo thorough assessment and must adhere to the requirements set forth by the law. In the Ugandan context, organ harvest for transplant at post-mortem is not allowed.
Of course, all our regional referral hospitals, not all of them are ready. We are going to have the public doing it as well as the private. Because already Mulago is almost ready. There are some private hospitals which have also shown interests.
Nobat at Kunda, NTV News.